Hundreds of thousands have been displaced by devastating floods sweeping across the nation since late November, with the East Coast bearing the brunt of the disaster with 9 affected states. We speak to Mercy Malaysia's Khadeejah Shafie, who is currently in Tumpat, Kelantan, to give us a picture of the situation on the ground.
The situation on the ground remains very critical, especially in Tumpat and Pasir Mas. So while the water level have receded in some locations, many homes, the roads, the bridges are still submerged, leaving families in the Pusat Pemindahan Sementara PPS unable to return back yet. For the past few days, we've been conducting on-ground assessment, and based on the data from Info Bencana JKM, the number of displaced individuals remains very high. Even though there has been no rain in some areas for the past 2 days, the influx of people to evacuation centers continues. So, for instance, one people return back to their home, 2 or 3 more arrive at the PPS. So the numbers continues to rise. Some of these centers are overwhelmed. They housing more than 2,000 evacuees, which puts immense pressure on resources and services.
She said one of the critical challenges in helping the flood victims is ensuring enough essential items reach affected families as soon as possible.
On the ground, the most immediate needs that we've identified include non-food essential items such as mattresses, towel, toothbrush, diapers for children and adults, and cleaning supplies. There is a limited source of supplies in Kelantan especially, so most of the people in PPS do not have these items. One of the ways is, of course, through donations, like you've mentioned. You can donate to organizations that are on the ground, so they can donate. They can procure and get the items straight away from the ground. Other than that, is through volunteering. You can send items in-kind donations as well to organizations or even to Jabatan Kebajikan Masyarakat, where they will be distributing the items to the PPS.
Khadeejah also highlights the health concerns related to the flood disaster, as she urges for the relevant departments to conduct strategic recovery planning.
First and foremost is the health concerns amongst the people in the PPS. The health concerns are escalating rapidly due to several factors. First of all, the overcrowded PPS, the lack of access to clean waters in some areas where pipelines have been damaged, and the risk of waterborne have been spreading. So to tackle this, Mercy Malaysia is working closely with Jabatan Kesihatan Negeri and other local agencies to mitigate this health risk. So I think what we can see, most of the things that have been reported on the ground are the lack of essential items, but the health concerns are also on the rise. For instance, today our team conducted a mobile clinic in Tumpat, providing medical care to over 400 affected individuals, ensuring that they have access to the service that they need. And lastly, while emergency relief is the immediate priority, this disaster also highlights the urgent need for mid and long-term recovery plans. So beyond responding to current needs, we must also think about empowering communities with the knowledge, training, and resource they need to better prepare for future crises. So investing in disaster risk reduction, rebuilding infrastructure, and supporting livelihoods are the important steps toward ensuring resilience in the face of recurring challenges.